Hello, and thank you for joining me. My name is Parisa Zakavi, and I'm a Senior Technical Officer at Monash Biomedical Imaging in Melbourne, Australia. Today, I'd like to talk to you about how low-field MRI scanners can change the future of access to MRI machines worldwide, and especially in rural and remote areas. MRI has been established as one of the most powerful diagnostic tools for disease detection, diagnosis, and treatment monitoring. However, despite this fundamental tool being crucial for diagnosis in many medical cases, it is not equally distributed throughout the world. In fact, the World Health Organization states that 90% of the world population do not have access to an MRI machine. Many factors can affect if someone living in a particular country has access to this imaging technique. Number one being the country's socioeconomic development status. In many cases, the country is not advanced enough in technology and health sciences and simply does not have the capability to offer this tool to its people. In other cases, countries might be in the middle of the war, whether international or a civil war, and political unrest hinders the establishment of advanced medical clinics. In the third case, cost is the limiting factor. MRI machines are not cheap, usually ranging a few $1,000,000, and countries who can afford it will have access to it. This further extends to population groups within a country. When a diagnostic method is expensive for the general population, only the higher income groups within that society will have access to it. In some countries, due to a lack of resources and the prevalence of many life-threatening diseases, the government may further restrict access of MRI to a particular diseases only. This means that not all people in that country have equal access to this technology. And finally, when resources are low, clinicians' knowledge of the technology tends to be limited as well. Therefore, fewer people than required might be referred to have an MRI done. As you can see, there are many complicated factors that result in access inequity among people of one country or among different countries. I'd like to present some statistics on the number of MRI machines now. Let's start with Australia and how the different states compare with each other. Based on a survey done in 2017, the number of Medicare-approved MRI scanners varies from 59 scanners for 80,000 people in New South Wales to only 2 for the same amount of people in the Northern Territory. This is a huge difference. Another example of access inequity is demonstrated by the fact that a person living in Victoria can have access to state-of-the-art standing MRI scanners, where the person living in rural areas of Western Australia has access to the most basic medical facilities, let alone an MRI machine. This inequity in access is of course observed globally as well. People in low and middle income countries have limited access to this technology despite them being more than 70% of the world's population. In this figure 4 in this map, you can see that the statistics for a couple of different countries are shown. You can see that the number of MRI scanners available is highest in countries like Japan, where there are 55 scanners per 1 million people, and next in line are USA and France, which have 38 and 34 scanners per 1 million people respectively. The inequality of distribution is more pronounced when you compare these statistics with a country like Syria, where there is literally 1 MRI scanner for all of the population. But there are countries even worse off than Syria, with literally 0 MRI machines. In the sub-Saharan Africa, some of Africa's poorest countries have no access to MRI scanners whatsoever. This is despite their population being in the tens of millions of people and neurological disorders such as epilepsy and dementia being quite prevalent. diseases that need MRI for proper diagnosis and monitoring. So far, I have presented you with the problem. To solve this problem, we can summarize what we need as access to MRI scanners that are simpler in structure and components and therefore quicker to build and install, are cheaper to purchase, they have lower operational and ongoing costs, they are smaller in size, simpler to use, which means easier and quicker to train the required personnel, and if possible, portable, and that would make a big difference. Of course, the concept of taking healthcare or health services to the remote areas is not new. An example is the RAMS health clinics in Australia that used to deliver health and medical services to disadvantaged rural and remote communities. Unfortunately, due to the growing GP shortages and high cost of locum services, it made it unaffordable for this service to run as a charity, and they effectively terminated their services in 2022. Heart of Australia is another initiative that started off as servicing remote mining areas of Australia and providing services such as general medicine, electrocardiograms, Holter monitoring, and sleep apnea testing. Another example of portable care is the mobile Claris health solution that operates in the USA and provides a range of sexual and reproductive health services. Now, for an MRI machine to be portable or mobile, we need to reduce the size and the weight of the scanner, which goes hand in hand with having fewer and smaller components, such as the chiller and the magnet. These requirements make it necessary to move down the field strength scale to what is called the ultra-low field range. There have been few scanners in the low field range, but only one so far in the ultra-low field range, and that is the hyperfine Super scanner, which has a field strength of 64 milliteslas. Now, all these requirements that we previously defined have become the advantages of an ultra-low field mobile scanner compared to a high field scanner. In this slide, you can see the Super scanner in operation. The Super scanner is small enough that it fits at the back of a van, and it can be taken to the patient, literally delivering the MRI to them. Mobile MRI diagnostic imaging is ideal for time-sensitive conditions like stroke and head trauma, where an imaging clinic is not accessible because of being in a remote or rural area, or the cost and wait time to get an MRI scan is prohibitive for timely diagnosis and care. Hyperfine Super scanner in particular has been used for other conditions as well, such as detecting mass lesions or midline shifts, and other clinical application areas are still being investigated. In this slide, you can see the brain scans of an ICU patient who reported an acute mental status change. Using the images obtained from the SUP mobile scanner, he was diagnosed with intraparenchymal hemorrhage. As you can see from the obtained images, and as it is expected, with a weaker magnet, the image is not nearly as high resolution as a 3D image. However, in the current age of artificial intelligence and machine learning algorithms, a tremendous amount of work can be done on improving the images without changing the hardware. And this is exactly the area of research of my team. I work under Dr. Jialin Chen at Monash University. This project is a multi-site project in which we collaborate with 4 other sites in 3 different states in Australia. Our aim is to improve the images obtained from the SUP scanner using artificial intelligence-based reconstruction techniques. At our MRI site, we are currently in the data analysis and image improvement stage. We aim to collate data from all other sites to further improve our reconstruction techniques and come up with far better quality images than what the SOOP scanner currently provides. Once we achieve this, we hope to test it in the real world by deploying the SOOP scanner in remote and rural areas of Australia, and then assessing the quality of images that we get for clinical diagnostic purposes, and in particular for brain injury, brain tumors, and stroke patients, and thereby making way for increasing access and equity to this vital imaging technique. Thank you very much for your attention.